Zambian culture, we are very collective, right? Everything is done in community. Ubuntu. I am because you are. I always wanted to be a person who helped people because that's how I grew up. When I came to UNC, I didn't start working in Zambia until maybe 10 years into my career here. Folks kept on asking me, you come from Zambia, why is it that you don't have a project in Zambia? I wanted to grow as a scholar before I went and engaged in Zambia. And so we asked the Ministry of Health to recommend an organization that we could work with or a person that we would work with. And Matthias's name came up. What attracted me to them is that they were on the ground, in the rural areas, with people who we are passionate about.
We have been working with University of North Carolina Global Social Development Innovation for the past 3 years now. So I feel pride. I am contributing to the welfare of the people in Zambia. And from the time that we started working, we have contributed to the welfare of the people in Londas district and in Zambia in many ways.
So at least health issues are a big challenge. Livelihood issues are a big challenge. Education issues are a big challenge. And so when we came up with this organization, we thought it would help our people to actually access some of these things: education, health services, economic services, and so on.
Our goal is to create income within the family, assets and wealth within the family. The saying goes that if you train a woman or educate a woman or help a woman build wealth, it's not just for her, it's for her children, her community, because that's how women are. So we've worked on quite a number of projects. The first one, which was Chuma Chazimai, which is translated Wealth for Women. This is an income generating project. Several women or several folks come together and they put a small amount of money in a pot. And then that amount is given to one person this week or next week or 1 month, whatever the cycle is, and then it goes round.
Yayi kashakuru kasono niliko nako kanjinga nilikugulako kawairesi nilikugulako niko na tumbuzi tuwili kamwana ako kalipo nako yayi nikukasambikirako kana kazi.
We work with women, we give them loans, and they go ahead and start a retail business.
Kwa nilikuwa niska business na mwana pa nilikuwa niska kupitira mwene hivi loan yene hii.
We want to look at, are they sending the children to school? Are they investing more in their business? Are they growing their business? So those are the outcomes that we wanted to look at, and health as well, right? How is their health after they have this income within the home?
Rising Fountains is implementing a number of projects, a number of programs in Zambia. And one of the programs that we're implementing is actually contributing to the reduction of maternal mortality in Londazi district.
We discovered that very few women were delivering at facilities, and this was mainly due to lack of education.
Because it's a rural area, most of the hospitals and health centers are far away from where the villages are. But you train these community health workers who go and visit these women in their villages where they are to ensure that they have the health care that they need. They can check their blood pressure, they can check blood sugar and all that.
And so we called them SMAGs, which is Safe Motherhood Action Groups.
Makuno natinalwala natinalwala nafika kula mbwe wakanipokelera basimagi mbwe kula nkabala liviro ngataya nyengo cha bango chokhalira basi chasuza pala mbwe ripoti kuboma mbwe motoka yatiyafika mbwe wakanitola no mantha wakaichosuka kamkati tingamanyamo yayi.
We work together and really understand what the communities need, and we build on that and we leverage that, and so yeah, it's a very transformational partnership.
The greatest gift we can give to a community actually is a healthy mother and a healthy child. When the child is growing up healthily, we are going to have intelligent children in school. We are going to have intelligent people out there that are going to plan for our country. So the whole future of the country depends on the healthy mother and the healthy child.
They are doing their part, we are doing our part. And so there's that reciprocal learning, right? So we learn from them, they learn from us. And so our benefit is there's an opportunity for students to learn from them. There's an opportunity for faculty for research. There's an opportunity for us to also do practice, right? We are social workers.
What RFDP is doing in Lundas is just a drop in the ocean. So the scaling up of such programs is very critical for us to have a healthy nation, which depends on the healthy mother and the healthy child.